you really do not realize, all the little things you do with your hands and all the little things you do in life with your hands until they don't extend properly and they don't work. And then once you get them repaired and you go, wow. About 5 years ago, my fingers started curling. I was wondering what it was about and why they weren't straightening, and then got researching, and it was Dupuytren's contractures. I kept looking into it and trying to figure out what to do about it. And it got more and more uncomfortable because you couldn't get your hands in your pockets. You couldn't do things you're used to doing, shaking hands, just life stuff. So initially did injections. They kept returning. That's when I sought out surgery to get it repaired in Dr. Hunter.
Derek has something called Dupuytren's disease. Dupuytren's is an inherited disease, tends to be people of Northern European descent, tends to affect more men than women, and it's an abnormal deposition of type 3 collagen into the palm. You can have it in other places on the bottom of the feet, but as a hand and upper extremity specialist, I see patients in consultation for palmar Dupuytren's. It leads to not just thick nodules and scars into the palm, but also deformity or contracture into the fingers.
I sat down with Dr. Hunter, and she went through what the surgery was going to be like, recovery, things to expect. These things are going to recur with Dr. Hunter's surgery. We're probably 10 years before I have to, maybe have to think about this again. Doing stuff like when I'm tying hooks for fishing and little things like that, when your fingers don't straighten and don't do all the things they're supposed to do, it's amazing, even if it's just your pinky. But my thumb was involved in this, even if it's just that, it makes it harder to do. That's the reason I sought out the surgery, to do something about it.
He's a very active, independent, and resilient person, so went back fairly quickly, which that's what we hope for people, it's what we want for them. I'm really happy with the result that he's gotten, and so now it just becomes maintaining that and following him closely to make sure that his motion stays as good as it is now.
This is so, almost life-changing, because the little things you had adapted to and not done, you worked around, now you can do.